Kenya has suspended flights to and from India effective Saturday due to the surge in COVID-19 infections in the country. Now, the decision arrived at following a crisis meeting by Kenya's National COVID-19 Emergency Response Committee that also set guidelines for all passengers jetting into Kenya from India between today and Saturday midnight. We begin our broadcast with our very own Stephen Leto.
Thousands of bodies are scattered in Delhi as families watch the flames in pain. Cemeteries are full. Hospitals are overwhelmed. India is sinking deeper into a COVID-19 crisis. Today, India has confirmed 360,960 new COVID-19 infections, the highest ever recorded in the world since the pandemic struck. In the same period, 3,293 deaths have been reported. This means one person dies in every 2 minutes. So far, 18 million cases have been recorded with over 200,000 deaths. India grappling with shortage of oxygen, medical supplies and hospital staff. In view of the dire situation, Kenya's National Emergency Response Committee held a crisis meeting and resolved to suspend all passenger flights to and from India. It takes effect in 72 hours, which will also those who need to travel back in either direction time to do so. That means it starts on Saturday.
But in the meantime, the committee regretted the events nonetheless, and given the situation, resolved to suspend all passenger flights in and out of India into Kenya for a period of 14 days, subject to review.
The Ministry of Health issuing protocols to be observed by passengers who will be arriving from India tonight until Saturday.
All passengers arriving from India within those 72 hours shall be subjected to rapid antigen testing upon arrival at our ports of entry and shall be required to strictly observe a 14-day quarantine period that will be closely monitored by our health officials.
KMPDU has already issued a list of selected hotels in Nairobi and Mombasa that will be used as quarantine centers during the 72-hour period. 10 hotels, 8 in Nairobi and 2 in Mombasa, have been certified to hold passengers who will be placed under mandatory quarantine at their own cost.
Cargo flights shall, however, remain in service subject to observation of the transport protocols.
The Ministry of Health is also keen on flattening the curve in the country. In the last 24 hours, 834 people tested positive from a sample size of 8,498, recording a positivity rate of 9.8%. However, 23 patients have died of COVID-19 related complications. Health Cabinet Secretary Mutahi Kagwe adding that the positivity rate had begun taking a bow, a trend pointing to a possible reopening of the economy.
The positivity rate in the country is now beginning to show signs of a downward trend, and if this continues, and if we continue adhering to the protocols so that the positivity rate continues to diminish, then of course that is a sign that we can begin to open our economy.
The ministry warning of declining supply of oxygen and calling on county governments to increase production. So far, 853,081 people have been vaccinated, with Isiolo, Garissa, Tana River, Lamu and Marsabit recording a low uptake of the vaccine. Stephen Leto, Citizen TV.